Ligaments in craniovertebral joints. Craniovertebral joint is formed among occipital bone, atlas bone, axis bone. Nuchal ligament present most posteriorly. Posterior atlanto-occipital membrane, tectorial membrane, cruciform or cruciate ligament of atlas, apical ligament of dens, alar ligament. Ligamentum flavum, as it moves upwards, modify into posterior atlanto-axis membrane, posterior atlanto-occipital membrane. Posterior longitudinal ligament continues upwards into foramen magnum as the tectorial membrane. The tectorial membrane attaches to the occipital bone on inner aspect. Cruciate ligament has the following parts: superior longitudinal band or fascicles, inferior longitudinal band or fascicles, transverse ligament of atlas. Apical ligament of dens is the most anterior ligament. It attaches the dens of axis to occipital bone. Anterior longitudinal ligament runs in front of body of vertebra. Anterior longitudinal ligament, as it moves upwards, modifies into anterior atlanto-axial ligament, anterior atlanto-occipital membrane. Ligamentum flavum, as it moves upwards, modifies into posterior atlanto-axial membrane, posterior atlanto-occipital membrane. Posterior longitudinal ligament continues upwards into foramen magnum as tectorial membrane. Posterior longitudinal ligament continues upwards into foramen magnum as tectorial membrane. Cruciate ligament has following parts. Cruciate ligament has superior longitudinal band, inferior longitudinal band, transverse ligament of atlas. Apical ligament of dens is the most anterior ligament. It attaches the dens of axis to occipital bone. Anterior longitudinal ligament runs in front of body of vertebra. Anterior longitudinal ligament, as it moves upwards, modifies into anterior atlanto-axial ligament, anterior atlanto-occipital membrane. Sequence of ligaments: posterior to anterior, posterior atlanto-occipital membrane, tectorial membrane, cruciate ligament, apical ligament of dens, anterior atlanto-occipital membrane. Sequence of ligaments: posterior to anterior, posterior atlanto-occipital membrane, tectorial membrane, cruciate ligament, apical ligament of dens, anterior atlanto-occipital membrane. Termination of spinal cord. Early fetal stage. Length of spinal cord is equal to length of vertebral column. Spinal cord is attached to coccyx bone. However, there is disproportionate growth of spinal cord and vertebral column. At birth, length of vertebral column is greater than length of spinal cord. Spinal cord terminates at level of upper border of L3 vertebra. However, the spinal cord is still attached to coccyx bone with the help of fibrous attachment called filum terminale. Spinal cord is still attached to coccyx bone with the help of fibrous attachment called filum terminale. Adult length of vertebral column increases further. Therefore, by the age of 2 years, termination of spinal cord reaches adult level. In adults, spinal cord terminates at level of transpyloric plane and lower border of L1 vertebra. In adults, spinal cord terminates at level of transpyloric plane or lower border of L1 vertebra. Filum terminale. It is made up of collagen fibers which connects the tip of spinal cord with coccyx bone. It is covered by all layers of meninges. However, only the pia mater reaches all the way down till attachment of filum terminale to coccyx bone. The arachnoid matter on filum terminale terminates at level of lower border of S2 vertebra. Therefore, the subarachnoid space filled with CSF terminates at level of lower border of S2 vertebra. Lumbar puncture for aspiration of CSF can be done between L4 L5 vertebra. Enlargement of spaces. Two major enlargements in spinal cord. Before going to that, we will confine to filum terminale. It is made up of collagen fibers which connect the tip of spinal cord with coccyx bone, covered by all layers of meninges. Only pia mater reaches all the way down till attachment of filum terminale to coccyx bone. The arachnoid matter and phylum terminale